I would like to begin the meeting with our first speaker, which is Professor Cpyrian Katongo from the University of Zambia. He's an associate professor in the Department of Biological Sciences. And I believe it was 2 years ago, he was nominated in 2019 to be the UNESCO Man and Biosphere International Coordinating Committee for Zambia. Today, Professor Katongo is appropriately talking about the COVID-19 impacts and adaptation and lessons learned over the past 2 years. And so with that, I welcome Professor Katongo, and I'm excited to hear your talk.
Okay, thank you very much. I see Zephyr shared the screen. So I'll talk about COVID-19 impacts, adaptation, and lessons learned. Next slide, please. Yeah, my talk will be structured as indicated there. I'll talk about the cause of COVID-19 and its origin, the transmission, symptoms, and diagnosis, some variants, socio-economic impacts, impact on fisheries and aquaculture, impact on research in the African Great Lakes region, adaptation to COVID-19, and lessons learned. Next slide, please. Yeah, I thought of just including this slide on the causes of COVID-19. It's caused by a virus, which is a coronavirus. So the disease is called coronavirus disease 2019. That's where COVID-19 comes from. It's a contagious disease caused by severe acute respiratory syndrome coronavirus 2, which is SARS-CoV-2. And experts say this disease originated in bats and is related to other diseases such as MERS and SARS, which have been previous pandemics. And the first case of COVID-19 was identified in China in 2019, where it made a jump from animals such as bats to humans. And at an open market in Wuhan, where they sell live animals. Now the disease is widespread and it has led to a global pandemic. Next slide, please. Yeah, the transmission is through the air. So droplets from an infected person which contain a virus are transmitted to healthy people. And the risks are there when you are very near to each other, and especially indoors. And also you have some transmission through eyes and nose and mouth when you introduce fluids in these organs. And the symptoms generally appear after 1 to 14 days of exposure. And about 2/3 of infected people show these symptoms, which include fever, cough, headache, fatigue, breathing difficulties, loss of smell, loss of taste, organ failure, and so on. And other people are at higher risk. And the standard diagnosis of this is using a polymerase chain reaction, using samples from the nose or from the throat. Next slide, please. Yeah, we have had some variants, different types of COVID-19, including the Alpha variant, which was called the UK variant. Then you had the Beta, which was called the South African variant, then the Gamma variant from Brazil, then the Delta variant from India, and now we have the Omicron variant, which is a new variant suspected to originate from South Africa. And luckily, we have a number of vaccines which have been developed within this short period in 2 years, which is unprecedented. Vaccines normally take 10 years or thereabouts, but now within 2 years, we have different vaccines, which include Johnson & Johnson, Oxford, AstraZeneca, Sinopharm, Pfizer, Moderna, and Novavax. Next slide, please. Yeah, now coming to the impacts. The impacts are mainly due to the measures which have been taken by different countries. And these impacts include the social impacts, where it has become difficult to mobilize large groups of people through meetings, conferences, political rallies, including our own annual general meeting. We can't be in person. Politicians can't campaign openly. And the pandemic has put a spotlight on already existing inequalities in healthcare or labor rights or social protection. And in some cases, the police have used the excessive force in trying to enforce containment measures. Some of the economic impacts include the loss or disruption of livelihoods, especially among vulnerable people. We have also seen rising prices of basic foods. We have seen unemployment and the falling exports due to the pressure on the already fragile economies. And we see that the region, the African Great Regions area, Great Lakes region area, will have slow economic growth in the next few years. And different countries are affected differently depending on their economic diversifications. And those countries which depend on tourism and exports are most affected. Next slide, please. Next slide, thank you. Impact on fisheries and aquaculture. We know that COVID is not caused due to eating fish. But even then, the fish sector has been indirectly impacted through changing consumer demands or preferences, and also due to market access or logistical problems related to transportation and border restrictions. Because of restrictions on transport, it is difficult to move fish from the point of production to the market. And this, for example, leads to increase in the price. And this has affected our fishers and fish farmers, as well as food security for millions of people who rely on fish as a source of animal protein and the micronutrients. Next slide, please. Yeah, here I share some blogs from different experts working on different lakes. And the first blog is my own, but it has been edited from what was submitted to AKEA. And in my blog, I mentioned that collaborative research on Lake Tanganyika has reduced because our partners from Europe and the US, or let's say North America, have had problems traveling to the lake. So activities have reduced in the collaborative research work on the lake. Other blogs are from colleagues from the US, from Tanzania, and from Uganda, sharing their own experiences. Next slide, please. Yeah, so I'm sure you are able to read the blogs. I didn't want to read word by word, but we can have the next slide. Zeph, please. Thank you. This is a continuation of blogs from Congo, DR, from Mozambique, and Uganda, and other places in the region. Next slide, please. Yeah, now if we look at adaptation to COVID, what are different stakeholders doing to adapt? We see that the implementation of effective public measures to reduce overall COVID-19 circulation using a risk analysis and science-based approach is one of the adaptation measures. The other one is physical distancing, wearing masks, avoiding poorly ventilated or crowded places, sanitizing our hands, and coughing or sneezing carefully not to infect others around us, and getting the vaccine in good time. There is also increased public health and medical capacities to manage an increase in cases. So this is done by governments through through the ministries of health. And there's also need to urgently address inequities in access to COVID-19 vaccines to ensure that vulnerable groups, including vulnerable countries, health workers, and older persons receive their required doses. And there is need to continuously revise project work plans in light of changing circumstances. So we have to adapt by rearranging our project plans, our research plans, and so on. Next slide, please. Yeah, other adaptation measures include preparing for future activities. So we need really to prepare more stringently than before. And then we need to also provide specific COVID-19 related capacity building support where necessary. And also do this support through capacity building using distance and online tools. And we also have to reorder our activities, starting with the desktop work and ending with field work or in-person activities. So most of the activities, including this virtual meeting, are sort of desktop work, and all the field work and other in-person activities are being carefully planned so that when they happen, there will be reduced risk, or they will happen at the right time. So methods like questionnaire-based assessments can be used in data collection, and this can be complemented by video conferencing. And we can replace face-to-face meetings with electronic exchanges, webinars, and video or Skype conferences, such as the one we are having now. Next slide, please. Yeah, lessons learned. We can now realize that research work can be done with less resources than traditionally demanded. So we can really reduce our research budgets below the current levels and still get some results. And there is also a need to develop closer socio-economic collaborations, including research collaborations within countries, and then also within African Great Lakes region countries. So before we go outside our country, let us optimize the resources we have by sharing equipment, sharing data, and sharing other resources. And then within the region, let's also share what we have to optimize our resources or resource accessibility. Let us share research equipment, research stations. Let us share data and so forth. Let us share personnel to carry out our work. And then we see that workplaces can be made healthier and more hygienic from this pandemic, COVID-19. We see that we can keep our workplaces cleaner and healthier. And also that we can embrace new technologies, such as the drones, virtual meetings, and other technologies to cope with the pandemic, this pandemic or other similar pandemics. And we also learned that a lot of official work or office work can be done remotely, say from home or from the field. So what we have learned a lot from this COVID, that we can do so much with less, and that we can collaborate more. And let me thank you for your attention. This ends my presentation. Thank you very much, Zeph, and thank you very much, Ted.
Dr. Katongo, that was very interesting. Thank you very much. Our schedule opened up a little bit. We have a little bit extra time if anybody has any questions. I'd just like to say that, but before any questions come up, you can either tap them in, or if you raise your hand, we can try and get to you. The lessons learned in the adaptation to COVID is very, very interesting. Especially your ideas about needing to do more collaboration and share resources and data. It's interesting that we say that as an adaptation process from COVID, when we're actually trying to do that with or without COVID. We just need to, I think, collaborate and get all of our resources anyway to do long-term monitoring, to make sure that we're doing research that is coordinated throughout the lakes. But anyway, I stand on my soapbox and say that often. But thank you. It's I like how this pushes us even more towards that. It looks like so far the comments are basically just comments and no questions at the moment. I don't know if there's any hands raised. And Shoko, yes, indeed. We need to enhance data sharing and collaboration among researchers. Okay, I've been informed no hands raised. So Dr. Katongo, thank you very much.